And we have Dr. K, Dr. Kevin Kavanagh, is a retired physician and also the creator, founder, president of Health Watch USA. Good morning, Dr. Kavanagh.
Oh, good morning, Jack.
How are you?
Oh, very good. Very good.
Good. Good to have you here. Tell us about Health Watch. What is that?
Well, Health Watch is a nonprofit patient advocacy research policy organization, and currently we have members from around the nation. We both publish in peer-reviewed journals and do a lot of activities on federal advisory committees, and we're very interested and focused on infectious diseases.
Well, the timing could be more perfect for that, obviously, with the coronavirus. And I guess we'll start this morning with some information that was supplied to us from Joe Allen, Harvard School of Public Health. What's that about?
Well, he is talking about aerosolization and that buildings are not safe, especially schools. These are very old. They do not ventilate well. There's approximately 90% of the schools he feels needs to be upgraded. And we've discussed this before, that it's just not opening up the schools. These are small rooms, poor ventilation. The virus may float around and easily spread. They need to have increased ventilation or air volume to dilute the virus. You have to pay attention to airflow, and you want to be able to either filter out or sterilize the air. You can sterilize the air by putting in a UV lighting system. So you need to have infrastructure changes in schools. We've talked about it in restaurants. It's the same thing with schools. I agree with Dr. Fauci in that I am not very hopeful that enough of the public will embrace the vaccine that you're going to achieve herd immunity, especially with all this misinformation floating around about hydroxychloroquine. So I really do think that we need to set up to live with this virus and start investing in infrastructural changes so we can go about a near normal type of life without being secluded in your home if you're high risk.
But that's not giving up, is it? It sounds a little bit like that.
No, it's not giving up. It's going out there and actually fighting instead of putting your head in the sand, hiding, and hoping it's going to go away. We need to start investing in the new economy and investing in strategies which allow us to live with the virus, especially while we're waiting for a vaccine. And you need to remember, Jack, even if we get over this virus, another one will be coming. We've had SARS, we've had MERS, we've had Ebola, we've had N1H1. Now we have this virus. You read other stories about viruses popping up over in China. This won't be the last time we deal with it. We need to get set up in order to do that. If you look at Singapore, Singapore had in their stockpiles almost 3 N95 masks per citizen ready to go just in case a pandemic hit. We hardly had a bandana for our healthcare workers stored up. I mean, Jack, we need a long, hard look at how we're planning for these and preparing for them. And part of it is designing our systems so we can live safely and healthy. It's just like when we talk about cleaning food. Everybody thinks that's, oh, how can you do that for the coronavirus? Well, you should be doing that for everything. You've talked about salmonella outbreaks. It's a way of living our life in a crowded planet. We need to start to do this.
Amid reports of huge house parties where attendees violate coronavirus restrictions, Los Angeles Mayor Eric Garcetti has decided to play hardball starting today. The Los Angeles Department of Water and Power will cut off electricity and water service to homes hosting large parties. What do you think about that?
Well, I think you do need to take some drastic steps. The overall feeling in the public that, well, you get the virus, 90% get it, and they get over it, and everything's fine. That may not be the case. It's not the case with chickenpox. It's not the case with the herpes virus. This virus affects every organ in the body, and it may lay in wait inside your cells. We do not know the effects of this virus long term, but you're starting to hear stories about long haulers and other problems that people are developing for the long term. We don't know how long. We haven't had this virus enough. But to go out and start hosting parties and spreading it around is really being cavalier on something which potentially could be very dangerous. So we need to respect it. especially while we're waiting for both the serum and the vaccine to come online.
Here's another interesting story. While coronavirus cases and deaths continue to trend upwards, experts say testing is going down. Per the AP, the number of daily tests is about 750,000. That's down 3.6% over the last 2 weeks. Overall, testing is down in 22 of 50 states, including states with spiking COVID-19 rates like Iowa, Mississippi, and Missouri. Experts chalking it up to slow wait times, claiming that people are discouraged by hours-long waits to get tested and then waiting days or even weeks to get the results.
Well, that's a problem. I mean, if the test takes longer than 2 days to get back, it really doesn't become a very useful test, because by that time you could have displayed symptoms or even reacquired the virus. And what I'm hearing, sometimes you're waiting 2 weeks to get it back. Well, that's useless. By that time, you're either over the virus. Most asymptomatic carriers start to wane 2 to 3 weeks with viral shedding, or you are absolutely got the infection and you know about it. It's crazy. So yes, we need better testing. And I know yesterday you had Dr. Fauci on and he talked about an antibody test. Well, I'm still like the other caller. I'm still searching for one. It's hard to get one, and it's hard to get one that you know is accurate. So these are available for a few people, like if you're an NBA basketball star. But besides that, it can be tough to get testing. And as you know, all tests have false positive and false negative rates. So ideally, you want to have another test. Look what happened with Mike DeWine, the governor of Ohio. He got an antigen test, which we haven't talked about much on this show, and that was positive. Well, it was maybe a false positive, because the more accurate PCR test, which they use for case identification and tracking, that was negative. Now he has to wait for another confirmatory test. So he's going to have 3 tests, and we have people having trouble just getting one test. So yes, we need a lot more testing. We need rapid testing, and that will go a long ways in letting us open up the economy. One strategy to do that is pool testing. That's where you can test a number of specimens at once. Do one test. If it's clear, they're all good.
Peter's been on hold for a while. Peter, good morning. Thanks for calling.
Oh, good morning. Thank you for this opportunity.
Sure.
I was going to ask Dr. Kavanagh if he's had a chance to check out a case study report by a Richard P. Bartlett, MD. He's come up with a protocol for COVID-19 that he feels is pretty effective, and he does have a complete case study that's well documented. And I know the doctor is looking at various strategies for helping to deal with COVID. There's an online site called COVIDsilverbullet.com. That was COVIDsilverbullet.com. And on that website, he gives the information regarding his full treatment protocol for COVID-19, as well as the case study that he has done. And I just wanted to mention that in terms of, I know he is seeking continuing information.
Thank you very much. You know, case studies at this point are good. They point to directions of research. But right now we have a number of very good randomized controlled trials which are going on, and a number of therapies which appear to be very promising, including dexamethasone. We also have remdesivir, and there are a number of other antivirals coming on. Now, I'll certainly check that out, but at this point, when you have a number of effective treatments that have been shown by randomized controlled trials, that now becomes the standard before going on and trying to institute treatments. So I think these case studies are what you look at to identify things now to study in a controlled trial, preferably a double-blind one.
Indeed. Doctor, do you have any sites or resource information that you espouse in terms of people taking care of themselves? For example, older people often are low in vitamin D, so if they take maybe a vitamin D daily, it might be helpful to their immune system and such. Do you have any recommendations along those lines just for the average older person in their 70s and 80s?
Most of the information that we have on COVID-19 is on healthwatchusa.org. Just click on the virus and you'll go to a large site with articles, news releases, and references. And of course, as you mentioned, taking vitamins is good. You don't want to be deficient in any vitamins. That can affect your health in multiple different ways. However, taking a lot of vitamins may not give you the benefit you want. There are some vitamins, and vitamin D is one of them, that your body will store up, and it's possible even to get some toxic effects. Not to scare you away from vitamin D, because iron's the same way, and so is oxygen. So too little's bad, too much is bad. Right in the middle is where you want to be.
I appreciate your call. Thank you, sir. We've got some texts to get to here. Could you ask the doctor if you can get that virus after you've had it once? Do we know?
I don't think we know for sure. There are a number of reports, and some of these were large studies, that indicate you might be able to get the virus to reactivate, or you start to shed dead soldiers, in other words, viral particles that aren't infectious. But to me, that may be some cells that are shedding viruses and the body's immune system's just zapping them before they can get anywhere. So at this point, they don't know. You do know that the viral antibodies that you have to fight the virus, they're not holding up long, so that's not a good sign. But you also get T cell immunity and memory cells, which play a role, and they may well give you longer lasting immunity. So at this point, we don't know. So I would still be cautious. Wear masks and social distance, even if you think you've had this. That's to play it safe. This virus hasn't been around long enough for us to answer all of these questions.
Here's one from Jim, kind of a lengthy question. Can you ask the doctor if he's seen the research by Dr. Rich, R-I-S-C-H, the Yale professor of epidemiology, who says that the hydroxychloroquine is the treatment we should be using, and Dr. Wallace from Cedars-Sinai, who is considered the world's authority on hydrochloroquine with over 400 published papers and 2,500 patients currently on both, say that it is the treatment we should be using. Dr. Wallace says in 46 years he has never seen an adverse reaction to hydroxychloroquine with one of his patients. Now, that's one text. We have another text from Dan that says hydroxychloroquine is not a cure but could have some preventative benefit if taken arthromycin and zinc before infection early on.
I'll address some of this. First of all, I'm quite scared that people are going to take this unproven drug, hydroxychloroquine, for a prophylaxis and kind of shy away from the vaccine. If that happens, we're never going to reach herd immunity. There are now 5 controlled trials, which are randomized, prospective, 3 of which were double-blind, which did not find an effect. And one of them was on prevention. So I would be very, very suspect of hydroxychloroquine. It makes no sense to take it with azithromycin. Azithromycin is an antibiotic. They both prolong your QT interval of your heart, which can cause very, very dangerous arrhythmias, could lead to death. And whoever thought of combining that is to me very suspect. And so I would certainly not take that combination. And to take it with COVID-19 is problematic. Yes, you can take it to prevent malaria or all of these other conditions, but you don't have a disease which is affecting your heart. You know that this drug affects the heart. You know COVID-19 can affect the heart. It affects multiple organs, and a heart is a major one. So if you take a drug while you have cardiac involvement of COVID-19, it may make you more susceptible to these arrhythmias. You add azithromycin to that, it could be a toxic mix. So I would not do that unless there are double-blind, randomized, controlled trials that show that it works. And right now, these controlled studies are showing that it doesn't work. So the onus is on people conducting a randomized controlled trial to try to show why it should be taken and why these other trials were in error. And you've got to do both, because there's a lot of evidence now, good evidence, that it's not working. So I would look for other avenues. And as we said before, there's a mechanistic study which shows hydroxychloroquine works great in monkey cells and the monkey enzyme which allows the virus to enter the cells, but in human cells, it uses a different enzyme. And there's another drug that blocks that enzyme, which is currently being researched in clinical trials. To me, that's where we should be placing our emphasis on.
We got another text from Rebecca. Jack, Dr. Kavanagh is clearer and more helpful than Dr. Fauci. who we had yesterday. Never miss his time with you. She's talking about you. Heard your time with Dr. Fauci, but it was like he answered from a script. Same old answers, but Dr. Kavanagh is spot on. So I don't want your head to start getting too big. We have just about a minute. You had a couple of things that you wanted to disagree with Dr. Fauci on from yesterday's broadcast. Can you cover them very quickly?
Well, there were two. One was on the statements about the antibody tests. It seemed like, to me, when you listen to that, well, you go out and get an antibody test, as we previously said, that's hard to do. And it's hard to find one that's going to be reliable. And the other was on the opening of schools. Even the yellow states have community spread, which is too great, in my opinion, to open up schools. You want the spread to be down very low. This is what they did in Europe, and even opening schools when the spread was low in the communities, they still had trouble and had to close some schools. So I think if you open it up when community spread is much greater than low, and you have buildings that are not set up for good ventilation and social distancing, it's a setup for, in my opinion, a disaster. So we need to be very careful.
Thank you, Dr. Kavanagh. Have a great weekend.
Thank you, sir.